Hello everyone. Today we are going to do very routinely doing procedure Hallux valgus correction. In this I am going to do the corrective osteotomy of a 44-year-old lady who is having Hallux valgus deformity since more than 6 to 8 months. And we tried all the treatment like stretching exercises, orthosis, but nothing helps. And in this Hallux valgus angle is more than 38 degree. So now we have decided to do the correction through the scarf osteotomy, and I also walk you through the surgical procedures and post-operative rehabilitations and management.
This is the deformity of the foot in which the hallux valgus is approximately going outward and pressing on the second toe.
This is the X-ray of the foot in which there is a deformity of the great toe of around 35 to 38 degree. Skin marking will start from the tarsometatarsal joint through the metatarsophalangeal joint and on the medial side of the foot, making a curvilinear incision over the bunion. After incision, try to create the flap, anterior and posterior flap. You can see the clearly anterior flap, and avoid any too much devascularization from the metatarsal head, otherwise it will lead to the avian, and expose the metatarsal completely from the medial side of the foot. After the exposure, you can see this subluxated portion of the metatarsal head. It's a bunion. Now we are going to resect this bunion with the electric saw, and we'll try to smoothen the edges. Now I'm removing these extra pieces of bunion with the electric saw, and in this try to be put one spike on the anterior aspect and one on the posterior side before starting the saw. And while cutting, continuous irrigations with the normal saline is very important to avoid the thermal necrosis. And slowly first start with the anterior and then you go for the posterior to cut this bunion. Before going for osteotomy, better to do the marking with the cautery in the jet-shaped fashion, and the lip of the jet should be around 45 to 60 degree angle. So now you can see that how beautifully this osteotomy has been created. You can see the gap between the upper and lower segment. In the lower segment, in the proximal part, here we have removed the little part of the bone, which will help in the compression. And with this you can also check through the opposite side of the bone. So after displacement of the upper segment laterally around 50%, and now we are holding the both bone with the bone clamp, and now I'm going to put the two screws. One is distal and one is proximal. I have stabilized the osteotomy with these two head screws. One is distal and one is proximal, and the lateral part of the upper segment which is coming out, I have nibbled with the nibbler and to smoothen the edges. Now you can see that the deformity is well corrected, and this gap I'm going to fill with the bone graft, which we removed the part of the bunion. So I have closed the fascia and the skin, and now you can see this fully corrected, and now the deformity is already corrected. Now you see the alignment, and the overcrowding is also been removed. And now I will do the dressing with the dressing pack and put the cast. Okay, and immediately I will go for the weight bearing. Thank you for watching this video. For more surgical videos and update, please do subscribe and like. Thank you.